Boone County hit another pandemic high for hospitalizations today.
163 people were reported in hospitals today with COVID-19. According to the Columbia Boone County Health Department, 21 residents have now died from coronavirus complications. It comes as the county confirmed 103 new cases. Missouri hospitals face a growing number of people in the hospital with COVID-19 issues.
And some of them are also dealing with dozens of their workers either isolating or quarantining. I took an in-depth look at the issue facing healthcare providers and what help exists for them. In Boone County, hospitalizations have picked up lately, with 51 residents admitted since November 2nd. That's approaching the previous high water mark of 58 hospitalizations in the whole month of October.
Healthcare providers are not at the breaking point. We are definitely at a bending point.
A record pace of hospitalizations comes with some staff isolating or quarantining due to getting the virus or possibly being exposed to it. Boone Hospital today reported 55 staff out due to COVID-19, about 3% of its workforce. Lake Regional Health Systems reported 38 workers out on Monday.
The care of these patients, they're sicker. We need more nurses per patient. We do ratios, so because of that, it takes more staff to care for the same number of patients.
Some hospitals around the state have gotten help from the state's Disaster Medical Assistance Team. That's a group of volunteer healthcare workers that step in when medical help is needed. Operations Division Chief Ryan Pratt says the months-long pandemic has been a challenge.
We weren't designed for long-term missions like this.
Pratt is also an EMT in Jefferson County. He says the DMAT is becoming inundated with staffing requests.
Right now we have at least 6 different hospitals that we're in with 40 different personnel that are helping staff. When they hit those critical shortages of nurses and different staffs, then we have to step in and help them.
The DMAT's team has doubled since the pandemic started. The agency has 465 people, up from the 180 it had before the pandemic. Pratt says he urges team members to stay safe when they're both at work and not at work to stay ready. MU Healthcare, for example, tells me the vast majority of the nearly 7% of its staff that got COVID-19 got it somewhere in the community.
Even though you're home, you still have to think about these things because it does have a domino effect. And you're absolutely right in my day-to-day job, staffing has become a problem because 2 or 3 providers out at one time simultaneously puts a strain on the team.